Hello everyone, I'm Dr. Omprakash Jamadar, Consultant Pediatrics and Neonatology at Apollo Hospital, Navi Mumbai. Today we are going to talk specifically about breastfeeding, importance of breastfeeding, because first week of August is celebrated as World Breastfeeding Week every year. And this year's theme is Step Up for Breastfeeding, Educate and Support the Actors. So World Breastfeeding Organization arranges this 1 week of celebration on breastfeeding because it is very important for the babies, the newborn babies and the mothers to have a proper nutrition. COVID has given a different scenario for us. For the parents, it has changed. So many things have changed. Their decision to have a proper choices of feeding for the baby has lot many confusions. So breastfeeding promotion is very important in present situation. Breastfeeding plays a dual role of preventing malnutrition as well as it provides food security and reduces inequalities. So what does this mean? Malnutrition, all of us are familiar with this word. Mother's milk provides adequate nutrition for the baby to promote the growth and development of the baby physically as well as mentally. The social security, the food security that we are talking about is the mother's milk is present immediately after the birth of the baby. And the mother don't have to do extra efforts to get the milk or prepare things from outside like water, formula powders and all that thing. It is naturally there with the mother. So babies are having a secure, nutritionally rich food with the mother that is enough for them. And third, it prevents inequalities. So whether you are a rich, whether you are a poor, irrespective of that, the mother's milk is same. And in fact, I will say it is different for different mothers based on at what stage of life baby is born. If baby is born early, we call it as a preterm baby. That mother's milk is specifically made for that preterm baby. And if it is a full-term baby born at 38 weeks, 40 weeks, that mother's milk is specifically different in comparison to preterm baby. So much of nourishment that babies get based on their gestational age, based on their weight. So that's the reason is breastfeeding week to increase the awareness of the people about breastfeeding. The World Breastfeeding Week celebration focuses mainly on strengthening the actors of related to the breastfeeding. So who are these actors? These are the real life actors and not the heroes and heroines that we see in the movies. These are the people, these are the doctors, healthcare workers who promote breastfeeding, support breastfeeding. We want them to make a warm chain for supporting breastfeeding, revamp the warm chain and the capacity of the actors to promote the breastfeeding. That is a specific target for this year's World Breastfeeding Week celebration. So in this way, we are going to promote the existing system, support the existing system to promote the breastfeeding that we are doing for all the babies. So here, how to help them? So we need to give some proper information about their role in strengthening the warm chain and how they can support the breastfeeding. We want to anchor breastfeeding as a part of good nutrition, food security and reduce the inequalities between different group of people. We want them to help by engaging them positively with individuals and organizations along the warm chain for support of breastfeeding. And we want to galvanize the action on strengthening capacity of actors and system for transformational change. I'm sure these wordings are very difficult to understand. I will try to stress on the role of actors, particularly on maintaining the warm chain. So let's discuss about warm chain. It is very important to keep environment warm before the birth of babies. Nowadays, we see hospitals where AC is on before the birth of the baby. There are chilling rooms and the baby is born in a cold environment. So the first step of warm chain is having a warm delivery room, warm environment. Once the baby is born, we want them to be kept in the vicinity which is warm for them immediately. And that is, if the baby is born normal delivery and baby is breathing and crying well, we want to put the baby on the mother's abdomen so that the baby's and skin to skin contact is there with the mother. So the natural warmth that baby will get from the mother will help to maintain their temperature. However, if baby is not breathing very well after birth, we do take them to an area called as a resuscitator or a warmer, which is kept on at least half hour before the birth of the baby, and we use warm towels under the warmer so that baby is received in a warm environment of warm towels that will help to decrease the heat losses from their body that will help to maintain their temperature and then help them to maintain their sugars also. Next is, once the baby is born, we keep them with the mother or under the warmer, and then we start drying because they are surrounded by wet water, the amniotic fluid in the mother's tummy. So you want to keep them dry by wiping this out all the wet secretions. And as I said earlier, the skin to skin contact helps us for maintaining the temperature, and this extra whatever the watery liquids are there surrounding the baby will remove of this, also helps to maintain the temperature. Next, we want to initiate breastfeeding as soon as possible. In a normal delivery, we can do a breast crawl. Some of you can see this. There are beautiful videos about breast crawl, that if baby is put on the mother's abdomen, baby goes towards the mother's breast and naturally starts suckling the breast. In case of cesarean section, sometimes it is difficult to do breast crawl, but I must say there that you should do trial of breastfeeding even in a situation of cesarean section. So feeding within 1 hour, that is called as a golden hour for the baby's life. That is very important to initiate breastfeeding in that time frame. Next is postponement of the bathing of the baby. Many places bath baby immediately after birth. That causes a lot of heat loss from their body. In fact, there is a oily layer that is there on the baby's skin after the birth. We call it as a vernix, which we don't want to rub vigorously and remove it, because that is a natural insulation for the baby. So we don't suggest bathing for the baby at least for initial 24-48 hours. Once that is, the gentle cleaning is done, we want to wrap the baby. Baby's head should be covered, the clothing should be given to maintain the temperature. We want mother and baby to be roomed in. That means we don't want the baby kept on one side of the room and mother kept at one side of the room. We want them to be together in the same place, same room. Bed sharing is one thing which will be cautious, because sometimes our mother is under the effect of anesthesia, or mother is too tired after the process of delivery of the baby. We want them to be safe. So in that situation, yes, for some time we can keep them away in a separate cot for a baby and mother, but as much as possible, mother and baby should be together. Then the professional services, as I said, the actors who are involved before the birth of the baby and after the birth of the babies, everyone should be alert as far as initiation of the breastfeeding within 1 hour of life. And in a situation where baby needs an NICU care or baby needs some other intervention, we need to keep warmth during the process of transportation also. So at Apollo Hospital where we are working, we have got a beautiful transport incubators where we use in-house transportation purpose, as well as we help babies to get from other different places to our hospital with the help of this transport incubator. So this is a warm chain maintenance which is going to be helpful to maintain the temperature of the babies, initiate breastfeeding faster, and in that I would like to mention specifically the initial skin to skin contact, breast call, and initiation of feeding within 1 hour of life is very important. So this is how the warm chain is maintained. So that's the reason this year's celebration of World Breastfeeding Week, we want to step up for breastfeeding, educate and support, and part of education is maintenance of this warm chain and supporting the family members also subsequently to maintain the warm chain, because initial few weeks, few months of life, babies are very sensitive to have loss of heat from their body, and that also causes a lot of problems for them. So we need to make sure babies are wrapped nicely. If you want to use AC, you can use, but keep temperature around 26-28 and nicely cover hands and legs. The palms and soles are more prone to get cold. So let's celebrate this World's Breastfeeding Week by stepping up for breastfeeding and educating and supporting all the actors, the real actors who are involved in the process of breastfeeding. Thank you very much.